Hello, this is Dr. Ian Beckingham. I'd like to welcome you to my website and to take a look at this video. Today I'd like to talk about goals of treatment. Goals of treatment. Every day patients come into my office and they have their chronic condition and they tell me all about it and what's going on. And I say, okay, let's establish some goals of treatment. I say, what are some realistic goals that you would like to do? And the number one goal is always to get my life back to what it was. And I say, that is a realistic goal, so let's work on that. So the first thing I tell them is I explain to them that our goals will be met together by working on a plan that begins with ERC. E, educate. I have to educate the patient about their condition and what's going on with them in this condition. R, reducing flare-ups. Chronic conditions are basically marked by flare-ups. Rheumatoid arthritis has more pain in the hands. Thyroid conditions have thyroid symptoms, hot flashes, losing hair, maybe feeling depressed, I don't know. Fibromyalgia symptoms, body pains, flare-ups, you could be having a real bad week. People who suffer from chronic conditions tell me they've got this kind of thing going on, the wavy pattern of chronic condition. So then we educate, we reduce these flare-ups, and then C is control. We have to get control of your condition again, control of your life again. So ERC. How do we do this? With 3 phases. These 3 phases start off with number 1 being we have to get what's causing this condition. We have to find that out through extensive testing. We have to do immune panel testing, CBC testing, we have to do food sensitivity testing. We have to find out what the cause is. Again, no stone is left unturned finding out what the cause of your chronic condition is. So that's the first phase. The first phase also entails finding out that food sensitivity and eliminating that food from our diet. It's a lot easier said than done, but it can be done, and you'll find out it's actually really not that hard to do. Also in phase 1, we have to modulate the immune system. Everyone has an immune system. Imagine 2 halves, like a seesaw on the playground. One half being higher, or the other half being higher. We want it to be even, but it just isn't that way with some people. Some people, one half is way up here, and the other half is way down there. That's not a good thing. These people are the ones that have severe chronic conditions. So one of the first things we have to do is control that and remodulate the immune system and regulate it, so that we have to find that balance. So that's what phase 1 entails. Phase 2 is the meat and potatoes of the whole program. That's when we really clamp down on these conditions and we reduce these flare-ups. We want them to be infrequent and less intense. Also, we have to fine-tune this elimination diet. We have to see, maybe you're eating something that you didn't even know had these food sensitivity things in them, like a salad dressing or your favorite barbecue sauce. We really have to find out what's going on there and prevent you from having them. Research has shown that even 1 exposure to gluten can last 6 months in the body. Think about that. 1 exposure to a food that you're sensitive to can actually have antibodies reacting in your system for 6 months. So that's why it's so important to fine-tune that. Also, we start to work on other symptoms in phase 2. Maybe you've got liver issues, gallbladder issues, kidney issues. We don't know. We're going to find those and we really start to work on those in phase 2. Phase 3 is the most important phase. That's educating you to the point where you can go out in the world and continue everything we've been working on together out there in the world, making you self-sufficient and control of your condition again. This is what it's all about right there. So we educate, reduce, and regain control. If you follow all 3 of these phases and follow my guidelines and we work together and you're a compliant patient, which I know you will be, we have an 85% chance of reduction of your symptoms. So 85% reduction of your symptoms overall. That's pretty profound if you think about it. Imagine if you had 85% less of the condition and the symptoms that you have right now. That'd be a good thing, I would think. So I invite you to look through my website or contact me through the website, email me, call me. More importantly, I advise you to come to one of my workshops. I do them every 2 weeks. I have workshops in my Glendale office. I have workshops in West LA office. I have them at the Beverly Hills Library. So contact me through the website, call me on the phone number, and we can get you to come to one of these workshops. That's really where you're an educated patient. You're already getting the E of the ERC out of the way. I like the sound of that. I look forward to seeing you or hearing from you. Thank you very much.